So you've been told you have neuropathy, but you have no idea what the cause is. Or maybe your first question is, what is it that's causing or creating the neuropathy that I have? And it's an important question to ask because the answer to that question can then lead us into taking the best care of you when it comes to improving and healing your body of the neuropathy. There are 8 categories of causes of neuropathy, and those 8 can then morph its way into a lot of different causes of neuropathy, but we'll talk about them. Diabetic neuropathy is the most common cause that we see. It's the most easily recognizable. You can test, you can see the diabetes, and over time there's a certain percentage of people that are diabetic that just go down that road and end up having neuropathy. Diabetes is a very common cause. The thyroid can lead to neuropathy, and that's an elevated or depressed thyroid can lead to damage to those nerves. Vitamin deficiencies, vitamin B12 is a common issue. So if you're low in vitamin B12, that can lead to neuropathy. Toxins, certain chemicals. Veterans of Vietnam, there was a lot of Agent Orange use out in Vietnam, and that Agent Orange led to lots of cases of neuropathy. Certain toxins can create that nerve damage. Certain medications can lead to that nerve damage. Chemotherapy is a common cause of neuropathy. Alcohol, very common cause of neuropathy, so watch alcohol use. Inflammation, different things can lead to more inflammation in the body. If your body is inflamed, then we need to decrease that inflammation. That's a common cause of neuropathy. Hereditary neuropathy, there are certain genetic diseases and hereditary issues that can lead to neuropathy, so it could be something that runs in the family. A disease called Charcot-Marie-Tooth disease is a common cause of neuropathy. And then the last category is idiopathic. Unfortunately, idiopathic means we have no idea what the cause for neuropathy is, and there's an unfortunately high number of people that fall in that category. But if we can pinpoint the cause of your neuropathy, there is a very good step that we can take, which is eliminate that cause if possible. If it's diabetes, we want to make sure we're taking steps to manage the blood sugar. Even if you're pre-diabetic, people who have been pre-diabetic for a long period of time have experienced neuropathy. Even though they're not in that diabetes category, they can still start to experience the damage, and that's the last thing you want. To think that you're okay, that you're not all the way into that diabetes category and still having the health problems as a result of it, you want to make sure that you're keeping your blood sugar in order. So if we figure out the cause, eliminate the cause, then we stop any further damage to the body. Then we take our 3-step approach to taking care of neuropathy, or in healing the body of neuropathy to improve the symptoms that we're having, and sometimes get rid of them altogether. And that is fuel. Make sure we have the right fuel for those nerves to be able to rebuild, for those connections to be able to grow. Blood flow, taking steps to improve blood flow out to those nerves. And then activation, taking some very specific steps to activate those nerves. When you fuel them right, when you increase blood flow to the area, when you activate those nerves, that's when you can start to see some really amazing changes in the neuropathy that we're experiencing. And I want that for you. I'm Dr. Emil Tompkins. Have a great day.